There is a kind of pain that is at once invisible and terrifying. Panic attacks. In their most extreme form, people are so paralyzed with fear that for years they're unable even to leave their own homes. But it turns out there's a pioneering new therapy that in many cases could be an alternative to drugs or months, even years of therapy. Jay Shadler reports on one woman's odyssey confronting her own fears.
For the first time, I called on my deepest, worst fear, and it scared me. Not too much time will pass before someone comes along and calls me to the hospital or drags me away from society.
Siddhartha Jackson keeps her secrets locked in her diary and her life locked in her room. She suffers from a profound anxiety disorder that has made her a prisoner of her mind.
I was fearing going crazy. I felt that I was sinking in quicksand.
This from a woman who until recently was the picture of exuberant youth. As a sophomore at the University of Massachusetts, Siddhartha studied ballet, worked part-time, and even competed in the Miss Boston competition. But 2 years ago, a series of extremely stressful events changed everything. First, her grandfather, with whom she was very close, died. A leg injury forced her to stop dancing. And finally, an intense personal relationship ended bitterly with an unwanted pregnancy. Then, without warning, while waiting to board a subway, she suffered her first panic attack.
And I was just getting at the threshold of the train. I'm feeling hot, I'm feeling sweaty, trembling. I'm definitely literally trembling. And the woman's like, you know, in the middle of the train, you gotta get on. And I'm starting to shake, and it's so intense to me, and I feel like this sense of unrealness. I am so disconnected. I'm feeling that I'm going crazy.
People suffer a sudden, unexpected burst of anxiety that we call panic attacks.
Psychologist David Barlow is director of the Center for Anxiety and Related Disorders at Boston University. He says a number of factors, including heredity, early psychological experiences, and a stress-related chemical imbalance in the brain can make a person vulnerable to panic attacks.
If you have a sense that when bad things happen or unexpected things happen, that they might be dangerous and they might be out of your control, if those things come together and then the stress triggers it off, then you can have a panic attack and develop a very serious disorder.
Just a week after Siddhartha's panic attack in the subway, a second panic attack. This time while she was driving this stretch of road in Boston.
I'm in the car and I get this hot flash. And then I get this like tingly, racy feeling, like I gotta get out. I can't drive this car anymore, you know, because it's too much responsibility. But in my head, it's like racing and racing and racing and racing.
As frightening as a panic attack can be, it can sometimes lead to an even more extreme condition called panic disorder with agoraphobia. That's what happened to Siddhartha Jackson. Once she suffered those first panic attacks, she became so fearful that she might have another one and lose control. She started avoiding every situation that might put her at risk. As a result, Siddhartha began withdrawing from the world, retreating to the only place she felt safe, her home.
I try to talk with her and ask her what's going on. To me, it was shocking. It's like, what's happened?
Annie McKnight is Siddhartha's mother.
My goodness gracious. Here's a child that, you know, she was an honor roll student in the middle school. You know, she was socially apt. You expected her to matriculate and move on to the world. And then all of a sudden, there's this pulling out the plug. And it's like all electricity is stopped being for her. She's still confined to the house now. It's over a year.
During the height of your agoraphobic stage here, could you have gone to a restaurant by yourself?
No.
Shopping mall?
No.
Movie theater?
No.
Taking a walk around the block?
No. No.
Literally, the house was your universe.
Literally my room. It was literally my room.
Finally, with the help of a therapist, Siddhartha took a first tentative step toward recovering from her agoraphobia.
She said, Siddhartha, if you could just get out and sit on your steps, just to get out of the house, to get some fresh air. And every day, just do it a little longer and longer and longer. It took me literally 2 months just to get around the corner from my house.
With the boundaries of her universe now measured in inches and dread, Siddhartha made a critical decision. She asked her mother to take her here, to the Center for Anxiety and Related Disorders, where a new technique is being pioneered to treat panic attacks with agoraphobia.
Are you ready?
I don't know.
Okay, let's give it a try.
One of the first things we noticed was that Siddhartha's anxiety disorder extended to her fear of elevators. She wouldn't consider taking one, even though the center's offices were 6 floors up.
Oh my God, I have so much more to go.
The treatment she hopes will cure her is called intensive exposure therapy. Without relying on drugs or traditional psychotherapy, which can take months or even years to prove successful, this new technique asks patients to confront the very things they fear the most, and is said to help many recover within days. Sandra Baker will be Siddhartha's therapist.
Well, I'm not going to talk her out of the fear. I'm going to ask her to experience it to the fullest so that she can learn that she can have this anxiety and her worst fear doesn't come true.
The treatment is based on the success psychologists have already had using intensive exposure therapy with people who have specific phobias, such as claustrophobia, fear of heights, or fear of flying. It's also been successful for people who have a fear of spiders, arachnophobia.
I know this is difficult because up till now you've basically tried to avoid spiders, you've gone out of your way.
The idea behind intensive exposure therapy is to have the patient repeatedly confront their fear in a controlled setting. Because all phobias are reinforced by avoiding a dreaded situation, each exposure to it actually lessens the anxiety, and the treatment can be done in as little as a few hours.
It's a lot less threatening than I expected.
It sounds so unreal, so fantastic, that something you've had all your life, possibly you could get rid of in one day. And yet, we can do it.
The question now facing Siddhartha Jackson is whether the same approach can be used to treat her panic disorder and agoraphobia, a much more complex anxiety disorder.
If you had your dreams, what would you want out of this experience?
My life. I want my life back.
Having finally come to a place where help is available, Siddhartha Jackson wonders, will this new therapy work for her? We return now to a young woman's struggle to overcome the intense fear that has made her a prisoner in her own home. Siddhartha Jackson is about to undergo a new form of therapy that will force her to confront the things she fears most. And wait until you see what happens next. Once again, Jay Shadler.
1 week before she begins her treatment, I meet Siddhartha outside the clinic in downtown Boston. With her therapist nearby, we do a brief field test to assess her level of anxiety in situations that have been difficult for her in the past. For starters, I suggest we try to take a subway to a local mall. She says she'll try.
When was the last time you were down in a subway like this?
Oh, about 2 years.
Do you feel like you could go through the stalls or not? You just tell me. I mean, I don't want to push you. You just tell me you don't want to do that. Why? What are you feeling?
Because then I feel like the pressure that once I get past the stalls, I've kind of paid for the token and I kind of can't go back. You know, again, it's like that first step that, you know, you're always trying to think of a way out.
Do you want to get out of here?
Yeah, I do. I would.
A week after we tried to take the subway together, Siddhartha returns to the Center for Anxiety Disorders to begin her therapy. The first 3 sessions focus on panic control treatment to help Siddhartha understand the nature of anxiety and how to deal with the fearful thoughts she often gets during a panic attack.
In some ways, it takes a leap of faith. The patient is so very fearful, and you're having them confront their worst fears.
In some respects, what you're really trying to do here is you're bringing her right to the brink of feeling panic. What if she has a meltdown? What if she has a panic attack right there?
Well, she will likely have a panic attack. But will that mean a meltdown? I don't think so.
Finally, a sort of panic attack chaser. Siddhartha is asked to drink an entire bottle of caffeinated water to actually heighten her anxiety so she can more fully experience the exposure therapy.
We're going to start today. Where do you think we're going to start?
In the elevator.
Yeah. How do you feel about that? What's your anxiety from 0 to 10?
Like 10.
For Siddhartha, like some other agoraphobics, elevators feel like vertical tombs. She hasn't used one in years.
Ready?
She'll take the stairs or nothing at all.
You can do it.
But not today.
Okay. It's okay. Just step in.
As it turns out, getting in is the easy part.
What's your worst fear?
That we'll get stuck
And then what?
and we'll die in here.
Okay.
The therapist is steady and reassuring, but it's still 15 minutes before Siddhartha can even attempt to close the door.
I'm thinking, like, I don't even know if I can do this.
Why can't you? What's holding you back?
I'm afraid. I'm so scared.
It's your fear. This is hard.
Under therapist Sandra Baker's guidance, Siddhartha experiences a full-fledged panic attack.
And I have all these anxious thoughts about what will I do when the door closes.
For Siddhartha, simply being able to ride this elevator will become an act of terror and ultimately liberation.
I'm going to take my hand off of the button and I want you to feel the anxiety. It will not hurt you. I'm taking my finger off. You're okay. You're okay. You're okay. That's just a behavior. That's anxiety. Feel it. You are fine. Look at how fine.
What are we doing? Oh my God.
Just let it come on.
Oh my God. Okay, I'm gonna let go of you, Sandra.
Finally, Siddhartha breaks through her worst fear.
You're doing it. This is great. You're doing it.
Oh my God.
Okay. Now don't go out of the elevator yet. I want you to just stay.
Eventually, like removing the training wheels, Siddhartha has to do it on her own.
Ready? Okay. You can do this. Oh, this is hard. She's going down.
Repeating the experience again and again breaks the back of her fear. And with each successive trip, Siddhartha's anxiety decreases.
Exactly.
Having taken her first leap of faith and found herself still mentally on solid ground, the next step was slightly easier. Back to the subway, again with therapist in tow. This time, although she was a bit nervous, she was able to take the train with the therapist. Then, once again, she had to do it on her own. Over the next 3 days, Siddhartha would not only ride the subway all over town, but also gain enough confidence to ride a bus by herself for the first time in years, to drive a car again, and to enjoy the simple pleasures of strolling the streets to do a little window shopping.
How are you doing?
I'm fabulous.
By the time I caught up with her at the Prudential Center in downtown Boston, Siddhartha seemed like a very different person from the young woman I'd met just a couple of weeks earlier.
I can just see the way you walk has a little more spring in your step.
Yeah.
Finally, to test the limits of her rediscovered freedom, I asked Siddhartha to join me for an elevator ride to the top of the Hub, a Boston landmark 53 stories up.
Are you ready?
Are you ready?
I am. I really, really am.
I think I'm more nervous than you are at this point.
You are.
Whether exposure therapy has a long-term benefit for people who have panic disorder with agoraphobia is still being researched. But for now, for Siddhartha, the sky's the limit.
This is a stunning view for anyone.
Yeah.
It must seem a little bit like a dream looking out at this now, doesn't it?
I mean, it's not a dream because I always knew it was there. You know, when you're locked in your house, you're locked someplace. You think that the world is so big and there's so many things that are out to get you. Now it's like, I have so much more to see. You know, I mean, I look at the horizon and I'm wondering what's beyond that. Because I'm gonna go find out. I'm gonna go find out.
And we are happy to report that Siddhartha was recently evaluated by another psychologist who determined that she no longer suffers from an anxiety disorder. She's now returned to her college studies.